Hi there and welcome to All About Money. I'm your host, Dhruv Tukekar. And this week we're going to be talking about the global market for oxygen supplies. Both the sector and the commodity made headlines this year in particular when India and other nations found themselves facing a supply crisis, which left people scrambling for any means to secure oxygen for hospitalized loved ones. It also sent prices for supply soaring on the black market, which also became a key player in the pandemic. So how does the market function and what are ways in which we can avoid dire situations like this in the future? Well, joining me from the US to talk about this is Leith Greenslade. She's the founder and CEO of Just Actions, a nonprofit dedicated to global development through 10 measurable goals. She's also the coordinator of the Every Breath Counts Coalition, as well as a member of the UN's COVID-19 Oxygen Emergency Task Force. Leith, thanks so much for joining us.
Thanks for having me.
Now, while I did bring up the fact that India was facing an acute shortage in oxygen, especially during a global crisis like the COVID-19 pandemic, this isn't necessarily a new problem for many developing countries. How long have shortages like this been going on for, and then what sort of sustained them for so long?
So many hospitals in low and middle income countries across every region of the world went into the pandemic without adequate sources of medical oxygen. So we knew that this was a disaster that was going to happen because those of us who've been working on oxygen for many years knew what the hospitals didn't have. So there were various surveys, and the small amount of data we did have prior to COVID told us that many patient populations, from the tiniest newborn through to the older patient with a chronic disease, often could not get oxygen when they went to hospital. So no, this wasn't, it's not a new problem. What is different though is the sheer quantities of oxygen that COVID patients need really hit hospitals hard. We saw hospitals in the US and Europe struggle to supply the quantities of oxygen needed. You can imagine how hospitals across Africa and Asia and Latin America, the Middle East as well, and even parts of Eastern Europe have just been unable to cope with the need.
Now, oxygen supplies is obviously a very broad term for this. What are some of the more commonly sought after devices or products that many of these countries were looking for during this year and the past 2 years as well?
So there's basically three sources of oxygen supply that a hospital can use. And they range from liquid oxygen, which is piped to bedside. You see the big tankers. We saw a lot of those when India went into crisis earlier this year, the big tankers that bring the liquid oxygen, typically from industrial sources like steel factories, oil and gas. They bring it in the big tankers into the hospitals and it's piped directly to your bedside. That's the way most oxygen is provided in high-income countries. But you also have PSA plants, and they're smaller plants that are located at the hospital. So the hospital has its own source of oxygen supply, and that can come to the bedside through pipes, or it can come in the big cylinders. And we've seen so many images of those cylinders in the last 2 years. And then the smaller option are the little mobile concentrators. They're usually on wheels. They're smaller devices. They can be moved around from bedside to bedside, and they take in ambient air, the air that's around us, and turn it into medical oxygen that the patient can use. So there's three options. You don't have to go with any one. Typically, a hospital can use all three. It's just that all three are rarely available. Now, in some of the poorest countries, they haven't had any of those sources available to them. So they haven't even had the little mobile concentrator. So they went into the pandemic with pretty much nothing. That's changed to some degree now. We've been able to provide a lot of support, but nowhere near enough. And frankly, we don't know what's going to happen in 2022. We just don't know what's around the corner.
I did kind of want to ask you about the availability of these supplies because there seems to have been a disproportionate distribution or an unequal distribution of many of these products around the world. Because I just wanted to know why that was the case, because some people might look at the developed world and wonder whether it's an issue of money or purchasing power. So, in your opinion, what were some of the drivers behind that?
Well, of course, it's an issue of money at the end of the day. It's companies that make all those three sources of oxygen are made by companies, big multinational companies often. And a lot of companies from your region of the world, China, produces a lot of these technologies. And they cost money. They're not donated. So countries that couldn't afford to buy the oxygen simply didn't have it. But typically when that happens, you would have global health agencies step in. So for example, in Africa, a lot of the HIV/AIDS, TB, malaria medications are provided at no cost by international agencies. The same for vaccines. If you can't afford them as a country, they're provided. Now, we didn't have this kind of oxygen support. So if a country didn't have it, it couldn't apply to any global health agency to get that support. We didn't have that really until COVID hit, and we had to create these programs from scratch where countries could apply to the UN and get oxygen support. And that takes a lot of time, and it's dependent on donor funding. Now, we haven't even had the donors step up to fund the vaccines that are needed for COVID. So oxygen was way down the priority list. So we still haven't had the donors step up to provide more financing to help pay for oxygen. We're still really scrambling to get that kind of support.
Another element that you've previously mentioned is the availability of oxygen data, especially for the WHO health leaders and UNICEF in particular. I mean, they spend critical months of the pandemic just scrambling to get the necessary data in order to help with distribution of this oxygen, and that is surprising because one would assume that they would have this at their fingertips. But why is that the case?
Well, the WHO has listed oxygen as an essential medicine for a very long time. Despite that, there were no data sources that would tell us what countries had medical oxygen in their hospital systems and what countries didn't. So we had no idea, we being the global health agencies, the UN agencies, the World Bank, the Global Fund, all the big organizations that run global health, I had no idea where the gaps were. And to collect that kind of data, you can imagine you have to go hospital by hospital to find out what they have and what they don't have. The ministries of health in those countries didn't collect that data either. So yes, a lot of time was lost just trying to figure out who had what, so how we could know how to plug the gaps. We lost a good 8 months, and it's shameful.
And speaking of the ministries of health, I mean, how much of a role did the health infrastructures of many of these countries play in this crisis versus, say, for example, these bigger organizations that are aiding in distribution as well?
Well, the ministries of health are essential. I think of them, they're in the driver's seat. They're the ones that are ultimately elected, if it's a democracy, and responsible for the health of their population. So it's the Minister for Health, the Ministries of Health that are responsible for solving this problem. So it all starts there. And then the international support is built around the ministry. So some of the ministries, I mean, it's a mixed bag. Some of the ministries are excellent. They're on top of the game. They know what they need and they know who to ask, and that works well. But many of them really didn't have the capacity to even collect the data or know what the hospitals had. In many of these countries, the government doesn't in fact run a lot of the health facilities. They're run by international donors. In many fragile states or conflict states, it's international agencies, humanitarian agencies that actually run the hospitals. So it's a very complicated situation. And then when COVID hit, on top of all of this lack of data and this complex situation, it just hit like a tsunami. And that's why beginning, I think, in the summer of 2020, we started to see oxygen shortages and deaths. And then that hit that horrific apex in March, April this year in India, when we never want to see again what the Indian people went through in those tragic months, scrambling to find oxygen.
And I mean, obviously, that also saw the growth of the black market in India as well, in particular. Do you think that, in the absence of the government efforts, or perhaps even the inadequacies of these health ministries, that the black market was able to fill a niche and it actually helped serve a purpose during this pandemic? Or do you think that's actually to the detriment of these global supply chains and, dealing with crises like this?
Yes, so when governments are weak and when international agencies are weak, and you have a pandemic where there's an exceptional demand for a product, of course the black market will step in. We saw that not only in India, but we saw it all across Latin America. We've seen it in Africa. So this is really the responsible organisations here are the governments and the international health agencies. If they got their act together, you wouldn't have this vacuum created where black market operators could step in and make a lot of money. Price gouging, poor families. We saw oxygen cylinders, the single cylinders, we saw them rise 10 times in price. And families had no choice but to pay that amount of money. You can imagine if you've got a sick family member at home, because you don't want to go to the hospital because the hospitals have no oxygen. So you're taking care of grandma or grandpa at home, and you are responsible for their oxygen every day or they die. So you will pay what you have to pay. And black market operators know that. But when it gets to that point, it means the government has failed and the international health agencies have failed.
And when it comes to paying, just to clarify, these would be out-of-pocket expenses, right?
Yes, out-of-pocket expenses. We know of stories of families selling things, selling furniture, selling technology to pay for oxygen.
Leith, obviously a lot more to get to, but we do have to go to a quick break. We'll be right back.